At the top for us tonight, the new school year is underway, but so is another rise in COVID-19 cases as the CDC reports an increase in cases across the country.
Yeah, Texas happens to be one of the 48 states seeing COVID cases climb. And here in South Texas, an outbreak has already forced one school district to temporarily close. Natalia Osuna checked in with local school leaders and medical experts about what they're seeing and whether there's reason for concern here at home. Natalia.
Yeah, Mike, Leslie, in the Rio Grande Valley, San Perlita ISD shut down for a couple of days earlier this week as his district dealt with a rapid increase in COVID-19 cases. Now, while local school districts say it hasn't gotten to that point here in the Coastal Bend, some are already seeing cases pop up. With the back-to-school season in full swing, the CDC is seeing an increase in COVID-19 cases across the country and in Texas. And here in the Coastal Bend, some districts say they're seeing cases too.
We've had a handful of COVID cases reported to our district nurse.
Amanda Barmore, interim superintendent at London ISD, says their overall attendance remains strong and symptoms they've seen are manageable.
Everything with mild symptoms, so a fever, sore throat, and after 24 hours fever-free, we encourage them to come back to school.
Barmore says that her staff is taking extra steps to make sure campuses are clean and disinfected.
They're actually the foggers that we bought whenever COVID was going around. So we have those, so we got the formulas and stuff for it. So we're just doing it again as a preventative. You know, it worked back then, working now.
Local pediatrician Dr. Eric Baggerman is also seeing a rise in COVID in both clinics and classrooms.
We see a big spike in clinic for upper respiratory type infections. Late August, early September, it's normal. Particularly why more COVID this time, I would say this year than last year in my own just observation.
While the symptoms he's seen are mild, Baggerman says that if your child tests positive for COVID, it's important to know updated guidelines before returning back to school.
There's no longer a special quarantine time for COVID-related infections. It's like other viral infections where based on the symptoms that you have. So it's not a 5-day or a 10-day like it was years ago. It's more based on how you're doing.
At the end of the day, Barmore says that every case is different and her staff will follow what medical experts recommend.
We do respect all the doctor's orders. So if the doctor says they have to stay home for 3 or 5 days, then we follow their instructions.
And good hygiene tips don't just apply to protect your kids against COVID. Dr. Baggerman says they can also help to prevent the spread of other respiratory illnesses like flu or cold. So stay safe. Mike, Leslie.